Hey guys, welcome to another Lifestyle of Eden podcast. I'm your host, Nick Tognetti. Today, I have a very special guest. She's a mentor, she's been growing into a friend, and just somebody who I have the highest levels of respect for in the functional medicine space. And it is Dr. Carrie Jones. Dr. Carrie, thank you so much for joining me.
Nick, thanks for having me on. I'm very excited.
So I'm going to let Dr. Carrie give a little bit of a background as to how she got here, her boards, all of those different types of things. But I've actually been studying under Dr. Carrie privately with a little bit of a group, and then also just going forward with some more depths in a topic that we are both very passionate about, which is about menopause and perimenopause. And what I think, and which we'll get to in a few minutes, I think is probably the most gaslit victims when it comes to the medicine space and not really getting to the crux of their issues and wondering what's going on. But before we get into all that, Dr. Carey, give a little bit of a background as to your whole medicine background, your Dutch test stuff that you have with them in the past, and just how you
Yeah.
got to where you are with being so passionate specifically in regards to menopause and perimenopause.
I have been in women's health since the dawn of day. So I have been in the medical field. I've been a doctor just over 20 years, but in medicine longer than that. And I knew from a very young age, women's health is where I wanted to go. I grew up in the South. And my health class was taught by the football coach. So you can imagine how that went. We learned next to nothing. We learned if the P went in the V, you'll get pregnant. And if you don't, you won't. And that was about it. That's all we learned. So when I got into medical school, I really resonated with all things hormones. It made sense for me. It clicked. Some people latch on to various areas, various expertise, pediatrics, musculoskeletal, whatever it is, sports. And for me, it was all women's health and hormones. So I did my residency in women's health, hormones, and endocrinology, had a practice that was 90% women in women's health. I had a very small subset of men, mostly husbands who were forced to go in and have their hormones evaluated as well. And
Yeah.
then while in practice, I decided I wanted to learn more and expand. And I had happened to meet the new startup company, this was many years ago, of Dutch Test. And I'd known who he was. He'd been in the lab space, the functional lab space for a lot of years. So I'd followed his work for years. And he came and presented at my clinic. I had a very large multidisciplinary clinic. And emailed him after the fact and I said, "You look like you could use some help. Do you need help?" He said, "Yes, I need a lot of help, but I can't pay you." So for 2 years, I volunteered at the Dutch test and I got really good at, even better at hormones and Dutch, and then finally came on part time and then finally came on full time as their medical director. So I was
Mm.
like employee number five back in the day. So I was their medical director for almost a decade, and I still to this day educate for them and advise with them and consult with them and love them. And then I jumped to Rupa Health. Rupa is a multi-lab platform that has
Yeah.
been
Oh, yeah.
acquired by FullScript. And so that really broadened my lab domain even more. I got out of just urinary and salivary hormone testing or blood hormone testing into other Lyme and GI testing and all these other kinds of really neat testing. And now, since they were acquired, now I'm just strictly in advising and education and podcasting. But the whole time it's been in women's health and hormones. That's it's what I do. It's what I love. I myself am perimenopausal, and I just remembered being in medical school when the Women's Health Initiative came out. That's the big study that said hormones cause cancer. And my mentor was like, and at the time I was in my 20s and she was in her 40s, and she said, "No, nope. Like, we're going to be respectful and we're going to follow the literature, but no, women need hormones." And so thankfully, I had this amazing education of a mentor who said, "We're not stopping hormones." So I didn't. I wasn't one of those doctors who pulled all our patients off. I wasn't one of those doctors who said hormones cause cancer. And I'm not one of those doctors who's only has about 2 or 3 years experience with hormones because I didn't believe in them. I have 20 plus years in prescribing hormones and working with hormones because of my mentor. So I'm such a proponent of women's health, hormones, getting older, aging gracefully, health span, all the things.
You said two things real quick. So the first one was you had said you're perimenopausal and stuff. Which I don't mean to put your age out here,
You can.
but I think it was just 48, right? Your birth.
48. I just turned
Yeah.
48. Yeah.
You, to me, have a healthy perimenopausal age, right? So, like, I have a lot of
Yes.
women that come to me and they're pushing these LHs and FSHs late 30s. And I'm like,
Yes.
hey, to me, okay, we can call this perimenopause, but to me, I don't really call it perimenopause, even though numerically it is. But I go, this is disease to me. Like where you're at, I go, hey, this is a graceful entering into that concept at the right age. Like it's always meant to be, in my opinion, late 40s, early 50s. When you start getting real early 40s, late 30s, I go, this is a result of some his mitochondrial damage from be it autoimmune, cortisol, whatever it is. So how do
Yeah.
you think that you have gotten to this point to be like, yeah, no, I am 48. I'm not full blown menopause. I am perimenopause, which is even better in my opinion. It's delay. It's like later in life, which is healthy to me. So, what do you think has been that big driver there?
I actually want to speak to the first part first because I have been arguing this for years. I understand that some women can go into perimenopause in their late 30s, but I agree with you, and I've long agreed with you that if the average age of going through the door of menopause is 51, 52, and
Right.
then we backtrack on either side, it's a 6 to 10 year walk in through perimenopause. Which, if the average age is 51, 52, then that means a
Wow.
lot of women are going through the door later because 51, 52 is the average. It's the center. So you should be somewhere between early to mid 50s, you most start getting symptoms, but you could also be mid to late 50s as well to make 51, 52 the average.
Wow.
So here's
Wow.
where it gets interesting. When women, and I see this all over social media and I'm constantly gently pushing back, I will see all the time, oh, I'm 33 and perimenopausal. I'm 38 and I just found out I'm perimenopausal. I'm like, I don't think you are. I don't think you are. I think what you have is significant dysfunction. Yes.
Yeah.
And I think a lot of the symptoms overlap or are the same. Yes. Would I say you're perimenopause? No. I think you have a lot of other things going on. It's affecting you in your 30s. It's getting labeled as perimenopause, and that's not what it is. Unfortunately, because not a lot of practitioners are digging into the whole everything that's going on, they're just going, yep, it's perimenopause. Here's progesterone or the birth control pill or whatever they're doing. And I have been, again, in my platforms, just, oh, hey, you may want to check other things. You might want to check nutrients and thyroid and gut health and sleep and stress and all these
Hmm.
extra areas that are neglected. And instead of saying, here's a label, you're perimenopausal, and that's the only thing it is. I'm like, there's a lot of other things it could be. And I think we really need to reevaluate labeling every single woman as perimenopausal. Now, I don't want to trigger women into thinking like, oh, she doesn't believe in perimenopause. Of course I do. Of course I do. But
Yeah.
having practiced as long as I've practiced and seen hormone dysfunction get better, as long as I have, so when women came to me in their 30s completely dysfunctional, then they felt a lot better. I'm like, okay, it's not perimenopause. Not
Right.
yet. Not yet. For some women, it might be. But for
Right.
a lot of women, I think it's dysfunction. For me personally, part of it, I do attribute a lot to genetics. My mom didn't go through menopause until 54, 55. And so, same for my grandmother. My maternal grandmother didn't go through into her 50s. So I do attribute longevity genes in that part. Like I'm
Sure.
just going to go
Sure.
through later. And I
Yeah.
am very grateful for that. However, I have lived a very different lifestyle than both my mom and my maternal grandmother, in that I would say my husband calls me very disciplined, and with health, with exercise, with sleep, with exposures, with stress. I'm not perfect, but I would say very disciplined relative to maybe the average American. And I
Yeah.
think that has helped contribute immensely. Doesn't mean I don't get symptoms. I do have symptoms of perimenopause for sure, but I feel really pretty good relative to a lot of women out there. The third thing is I'm very educated. This is the thing I focus in. And so, just like if somebody listening was a teacher, their kids are probably extremely educated. If somebody was an accountant, their numbers, their family finances are probably fantastic.
Yeah.
I'm a doctor who focuses in women's health. I have the benefit of all that education to apply to myself. And I realize that, and that's why I try to get it out to the masses.
I think what I think is interesting too is me and Jay were just talking last week on a podcast about I told him one of the classes at my university is on neurodegenerative disorders is the unfathomable statistic that 1 in 2 Americans over the age of 85 have some form of a dementia.
Yeah.
And I was like, that's just that if you really think about that statistic, like I remember I had my mentees, we had about like 10 of us or whatever on a call this week. And I said, if you think about that means statistically 5 of us in this room right now are not gonna remember our grandkids' names when we're 85.
Yep.
We're not gonna, that's incredible. And the reason we were bringing it up was I said, this is not a topic for 85-year-olds. This is a topic for people that are 30 because it's what you're doing at 20, 30, and 40 that is leading to what you're going to get when you're 85. And I
Yes.
think the same is true for menopause in a lot of ways, which if you disagree or agree, please share. But the reason I say that is because to get to be 47, 48, and be like, hey, I'm just now entering into peri, that is a product of your lifestyle choices from when you were 20 and 30 and going into your 40s. And so, with that said,
Maybe not
speaking,
20s.
or maybe not 20s. Okay,
Maybe not
you're,
early 20s, but
yeah,
yeah.
okay.
We all had
So,
fun.
speaking to the 25-year-old, the 33 year
Yes.
old, the 31-year-old, what do you think you could give them as a couple things right now to say, hey, listen, this is not for when you're 47. This is for you now so that you can get to be 48 and gracefully go through it. What are just a couple, without going too deep into that on this podcast, what are a couple things on the
Mhm.
surface level that you'd be like, hey, this is what I would recommend that you focus on now and start really applying to your life and so forth?
It's the same with like osteoporosis, right? Osteoporosis is not evaluated until a woman is 65, and by then she has it. So I'm all about prevention for everything. So some of the things
Sure.
we want to look at are really dialing in the foundations and the basics. It's essentially like manage your circadian rhythm, right? So it's getting light. Our body is directed by light. We are set and reset every day by light and darkness, not the herb ashwagandha, not from
Yeah.
yoga, right? Not from your coffee, but literally light and dark is what sets the circadian rhythm as a human. How we sleep, what we choose to put in our mouth, the amount of muscle that we have in our body, how we manage stress. Like I always joke, we are like bougie house plants. Do we get enough water? Have we gotten sunlight? Do we have fresh air? Do we have nice soil? Like
Yeah.
those are the what's our do we have a community of plants around us that we like? Like
Yeah.
those are the basics, right? Those are the basics. And I tell everyone, it doesn't matter who it is, like in your 20s, 30s, that's what you really have to dial in on. Instead, a lot of people are burning the candle at both ends, very stressed out, high anxiety, eating like crap,
Yeah.
drinking a lot, not loving their communities, not in great relationships, not setting boundaries, and then they're collapsing into their 40s
Mm,
with the hormone rug being pulled out from under them and they can't figure out why they feel so bad. I'm like, "Oh, I know. We didn't get the education that we have to dial in our 30s." It's starting to happen more now.
yeah.
Definitely if you're on social media, people are more awake to what they need to do in their 30s,
Yeah.
but it's a bit of an uphill battle just because the education doesn't start young.
For the sake of the audience, I want you to just listen that Nick is not crazy whenever Dr. Carey, you don't even, I don't, unless maybe you've just seen it on social media or whatever, you don't even know about my 7 pillars of disease reversal,
I,
prevention, and longevity. It's what my whole university is
yep.
based off of. And so, like, a lot of coaches, practitioners, a lot of Jason's coaches, a lot of these people, they're adopting them and teaching them to medical professionals now. And the 7 pillars, they are, the first one is nutrition. The second is stress management, environmental toxicity, and community. The
Mhm.
third is body movement. The fourth is hydration at the cellular level. The fifth is oxygenation at the cellular level. The sixth is autophagy. And the seventh is sleep. I always tell you, if you do these 7 pillars of disease reversal, prevention, and longevity, I go, you will basically prevent any disease that we
Yeah.
see in the United States of America. And even potentially reverse just about any single thing almost that comes upon you. And so the fact that you just said the basics and you listed about four and a half of those, I'm like, this is literally when you
Yep.
said
And
community, like that really hit me because laughter, community, all of those things, laughter lowers cortisol by over 30%, just like that. And so I'm like, it's just such a critical component. And isolation, unfortunately, is such a major part of the lifestyle today.
when we look at, if you look at the nervous system and you look at the polyvagal therapy research, so the polyvagal is like we talk about like your fight or flight or freeze, and then we have rest, digest, heal, etc. So we have these two sides to us. And right now in the world, and for a long time, we've been stuck in this fight, flight, freeze, or type of high chronic stress,
Sympathetic, yeah.
overwhelmed, sympathetic all the time, burning the candle at both ends, a lot of exposures, poor relationships, unhappy, et cetera, et cetera, et cetera. One of the ways and you hear about you should meditate, you should breathe. Well, a more fun way that you hear to pull you out of this are things like play and laughter in
Yeah.
community. And adults forget how to play. Unless you have maybe little kids, I would say a large majority of adults have forgotten to play. They don't run, they don't skip, they don't jump. They don't laugh unless maybe somebody has sent you a meme that's really funny. Like even then, it's few and far between. Their community is changing as women get older and their hormones change, men as well, but since we're talking about women, as estrogen and progesterone decline, it can change our brain neurotransmitters such as serotonin and dopamine and oxytocin. So we feel more introverted, we're less bonded, we don't care, we don't want to leave our house. And as a result, this impacts our community. A lot of our community is texting. It's not face to face. We don't see them in person. We're not reading facial expressions and laughing and getting to know each other. It's quick texts back and forth. It's very different. It's really changed. And in social media, doom scrolling is not community. And I think we've just really lost that. And so our poor bodies in a lot of ways are just struggling. They're floundering. We
100%.
need community, even if it's a community of one or two. You don't have to have a
Right.
massive friend group or family, but like you need to feel safe. And if you don't
Right.
feel safe and you're not having fun, we get stuck in that fight or flight.
Which we won't get into here, but it's literally the cell danger response concept
Yes.
what you just brought up.
Yes.
You know what I
Yeah.
mean? But so with all that said, what I really like to dive into menopause. Obviously, I feel like on your social media, it is 95% of your posts, which is
Hmm.
awesome. It's perimenopause, menopause. This is what's going on. This is the stuff that your doctor is not catching, why you feel gaslit. This is all those different concepts. And so for me, the reason it hit me so hard, anybody who really studies under me or has been around me knows I'm really pressing hard into this. To me, I feel like it's my future of where I really want to hyper focus in. And the reason being is because it's the biggest. I hate to say the word market because I don't want to look at it as like a money thing, but it's the
Right.
biggest market essentially, or biggest demographic, if you will, in the world, in that over 2 million women a year are entering into it. And it is over, debatably, but over half a woman's lifetime.
Yeah.
And it's the biggest change that a woman will ever go through while currently on the earth, when it comes to
Yeah.
their physical body, at least. And so, with that said, I want to hear from you and for the audience to hear from a menopausal expert on menopause is the unraveling of puberty in a way.
Yes. The reversing of puberty. Yeah.
Exactly. Can you go into what we mean when we say that? And then
Yes.
also, there is a little bit more complications in that, hey, it's not just not producing the progesterone and estrogen as before. You literally don't have the follicles to even do that. You know what I
Yeah.
mean? So give insight on that. I really want them to learn from you on this.
So if you think of puberty when we were younger in our early teen years, we're connecting wires. So wires are getting plugged into our brain. You were going to reproduce, you were going to grow and develop, you are going to be able to hopefully, if you want to reproduce. Now, again, I think I don't want to trigger people who don't want to reproduce or haven't reproduced, or I don't want to get pregnant, but the female body is designed around that. And so all puberty for us is the brain, hypothalamic, pituitary, ovarian axis. Can you have a baby? And all those wires so you can grow and develop, have a period, ovulate, implant, grow a baby, nurture a baby, love a baby. Everything's around that. When all these connections occur and she starts getting her period in her teenage years or younger, then all those hormones now impact every single system in the body. So every single system, all 12 systems of our body, from the skin to the heart to immune system, everything have receptors for estrogen predominantly and progesterone. So not only is it just a uterus ovary thing, but it's an entire body system wide thing.
Yeah.
Now we're reversing out of it. Now in perimenopause, the body goes, thank you for your service. We are going to back out of this. We're going to unplug, essentially. We're going to rewire these neuronal pathways and change the signaling. We can't remove the ovaries and uterus, but what we can do is we can change the wiring so that eventually you will not ovulate and you will not get pregnant. When this happens, it's like living through a remodel. If anyone's ever lived through a house remodel or even a bathroom remodel, it's a giant pain. It's a mess everywhere. It's chaos. But at the end, everything's amazing and wonderful and you love it. But that in between chaos part is the perimenopause part. So as you're rewiring the brain, the signals are changing that go down to the ovaries. At the same time, every
Mm.
single month, you have these follicles on the ovary that contain the egg. And one, in theory, gets released, and that's what you ovulate with. But a whole bunch of other ones naturally die. They can't, it's like a terrible like reality TV show. Like only one survives and like hundreds die at the same time.
Yeah.
So
Yeah.
gradually, month by month, year by year, these go down. You're not at zero, but you're down to a point where the signaling in the brain changes, the amount of follicles you have are changing, and so everything gets messed up. You don't make hormones like you used to. You're not ovulating, releasing the egg like you used to. So remember I said it impacts all 12 systems of the body. So now all 12 systems of the body are going, hello, where's estrogen? Where's
Right.
progesterone? And so not only, again, is it an ovarian uterine issue, it's a systemic issue. This is why women feel systemic symptoms. This is why it's
Yeah.
not just a period. Oh, my period's changing. But it's like, why do I have heart palpitations? Why is my
Yeah.
skin changing? Why do my
Immune
ears itch?
system.
Right? Like
Yeah.
it's all, why did I develop autoimmune all of a sudden? Like
Right.
it's
Right.
all 12 systems.
What I find interesting, and obviously we've talked about this a lot, where there's just not an overflowing amount of conclusive research on certain aspects of phytoestrogens and this, that, and the other. We have thoughts that we're coming up with, and maybe certain clients or patients that were like, hey, that worked well, that did this. But
Right.
from a real definitive PubMed, if you will, literature concept, it's still very new. And so when it comes to pre-puberty, they're not having tons of estrogen and progesterone. And when it
Mhm.
comes to postmenopause, or I actually menopause, not postmenopause, menopause, you also
Both.
have that same thing, right? And why do you think, just from the hormonal perspective, hey, both sides don't have the estrogen and progesterone? Why is it that these ones over here, these menopausal women, are struggling so much worse than the pre-puberty ones?
The pre-puberty never had it. So they have age on their side. They have only 10 years, 11 years, 12 years, and they never had it to begin with. Then they got it for decades. Then it gets taken away.
Sure.
So when you get it and it grows up over those decades, right? They've had all this estrogen, like all those things mature, all the receptors increase, like all these neuronal pathways increase and change and develop. So it becomes a maturing, a blossoming, so to speak.
Yeah.
And now all of a sudden it gets taken away.
Your receptors became spoiled, and now
Oh,
you took it away.
yes. All, and I don't just, again, not just the uterus, but like all the, like the brain
Immune
increases
system, all
estrogen
of it.
receptors when
Yeah.
she's going through perimenopause to be like, hello, where's my estrogen?
No,
I'm
no,
working.
that's a good point. It's for me, I don't miss kids because I don't have any. But if I
Right.
had kids, then I'd be like, if you took those away from me, I would be totally devastated. So that's a very
Yes.
good yeah, I like how you put that.
Plus,
So
she also has decades, 4 or 5 decades under her of exposures, stress, wear and tear on the body, environmental toxicants. And in this day and age, as opposed to
yeah.
1700s or the 1800s, it's very different.
That's what I was gonna bring up was, do you also believe too that it is the fact that these women in menopause have had 30 or 40 more years of extreme mitochondrial damage that is
Yeah.
finally just accumulating, and then the rug being pulled out of hormones is just now a reality of, hey, listen, I'm now forcing you to deal with your crap. Like, I'm now making you deal with all of your health issues, with all of your bad habits. You just have no, you've just hit that barrier. Like, do you think
Yeah.
that's a big part of it?
I think it can be a big part of it for a lot of women. Like I said, it's the woman in her 30s. This is not a judge or judgment at all. It's just very common in the way life is set up.
Yeah.
I was going to say for better or for worse, mostly for worse, but she's burning the candle at both ends. She has all the emotional load on her. She's very stressed out. Children, if she chooses children, like family, parents, obligations, work, not able to complete, and plus all the environmental toxicants that we a lot can't control. And so she, as I said earlier, slams into her 40s and she loses the estradiol progesterone signaling, or it's declining, or else on a wild roller coaster for a while before it declines. And now the body is no, nope, no, we're not doing this anymore. I physically can't. And that's
Yeah.
how a lot of women describe it to me. They're like, I used to be so resilient. I used to be able to do anything. I used to be able to remember and be able to take everything on. I said yes to everything, and I can't do any of that anymore. And I'm like, I know. I
You know, one of
know.
the one of the things that I just, and I think I know I've brought this up to you like half a dozen times. It'll probably end up being a half a dozen more, but I keep getting stuck on this fact of, we talk about progesterone, and or not, we talk about, I'm sorry, we talk about the alpha side of progesterone and it creating allopregnanolone, which doesn't increase progesterone. I'm sorry, which doesn't increase GABA. It just binds to the receptor, and that fulfills the need of those symptoms, if you will,
Right.
like anxiety, sleep, this, that, and the other. So if not,
But remember, GABA also declines naturally with age.
but so my question is, with not raising literal GABA, but just binding to the receptor being good enough, can that also be a very high potential when it comes to estrogen, where, hey, maybe not raising the literal estradiol, but binding to those receptors, pulling back a lot of the symptoms of not binding to the receptors? Like, is binding to the receptor, can that be either enough or a darn good benefit?
So if you bind to the receptor, remember receptor binding is called an affinity. So you can be at 100% affinity, meaning the full key fits in the full lock and turns it completely. You can
Right.
be at like a 1% affinity. So if you have estradiol, which is the main estrogen, and you bind to its receptor, it's estrogen receptor, alpha receptor, it's at 100%. It loves that receptor. If you are a soy product, which is a phytoestrogen, and you bind to the receptor, your affinity is much, much lower. So you're not going to get the same output, so to speak, when it comes to the genomic signaling. Now, can it be really helpful? Yes. If you don't have any estrogen, you're very low, and that's what you choose to take as a phytoestrogen. That's why women will say, oh my gosh, I took a phytoestrogen, some sort of menopausal product, or I upped my soy intake. My hot
Yeah.
flashes got better. My mood got better. I just felt better. And I'm
Yeah.
like, you didn't have any estrogen. So you got a dribble, and thank goodness that helped. Whereas somebody else who has a lot of estrogen may not have the same impact.
I like that you said that because actually that PubMed literature that I had shared with you, I think you've already read it
Yeah.
before that, but that was talking about, hey, can phytoestrogens be either a replacement for HRT or can it really help you with menopause? All those things, right?
Yes.
The bottom of it literally said all of our literatures have only been studied with one phytoestrogen, which has brought benefit but hasn't completed the circuit, if you will.
Yeah.
However, the civilizations we've studied, like Japan and so forth, they eat a plethora of phytoestrogens. And so we need to do a study that has an abundance of them so that we can actually give that full affinity. Because one of the things that they show in that study is if you take an E2 molecule. And then you take, they had about six classifications of phyto. Every single classification had about two-thirds or a third of that full E2 molecule, to where if you only have one of them, sure, you don't fit the full E2 molecule. You may not have full affinity, but if you had all of them, you really started getting a big different picture. And we just don't have studies that show somebody doing this or whatever.
Yeah.
So I've
And we don't have studies, and you and I have talked about this. We don't have studies that show, like, if you choose to go the phytoestrogen route, whether it's supplements or food, like, we don't have any long-term data to show it's going to prevent osteoporosis, or it's going
sure.
to maybe reduce cardiovascular events. It's going to, you may definitely notice your hot flashes improve. You may definitely notice you sleep better. I'm not arguing that at all.
Right.
My only hesitation is sometimes people will say, it's a 1-to-1. I'm like, it's not a 1-to-1. The affinity is not 1-to-1. And I don't
Right.
have the data to say, sure, if you go on the different classifications are like flavonoids or lignans or stilbenes or phenolic rings or all these different type of
Right.
phytoestrogens. Yes, I can assure you, you won't have vaginal dryness, or I can assure you, you won't have bone loss. We don't have that data at all. Not yet.
Yeah.
And
I
it
was gonna
also
say,
takes decades because if you start a woman in her 30s or 40s, you have to follow her all the way
sure.
through to see the outcome. Yeah.
I was gonna say, 'cause the results I'm getting right now, I probably have about 30 different women right now where this is actually happening, where their sex drive is radically improving, all their night sweats, all of that is gone. They're having all of these symptoms, but like you said, when it comes to the big picture, hey, in 10 years, is this gonna stop you from getting osteoporosis? I can't tell you that. And
Because the big ones are I call them, a girlfriend of mine, we call them the four horsemen or the four horsewomen. So it's cancer. What are the big things we're trying to prevent for everybody, but specifically for women? So we have cancer, we want to prevent cancer, neurodegenerative disease, so dementia, Alzheimer's, etc.,
sure.
cardiometabolic, so heart, diabetes, metabolism things, and then diseases of frailty, so broken hip, osteoporosis, things like that.
The leading cause, or one of them, of a lot of the people illnesses and deaths over 75 is falling, breaking a hip, all of those
Mhm.
things, right? So
Yes.
huge.
If grandma breaks a hip, like the statistics on outcomes are not good. And everyone knows
Right.
it. Yeah. And
Right.
everyone knows it.
One of my mentees actually asked me the other day because I was doing a teaching for them on endo and GLPs with endometriosis on only 5 units of GLP to pull inflammation while you
Yep.
fix the detox and all that kind of stuff. But one of the things that I had mentioned to them, because they know that I'm very big, like in my diet, I have a lot of phytoestrogens. Like I
Mhm.
have flax seeds, I have tempeh, I have pinto beans, I have raw cacao. I personally am a big believer in this for my own self. And they said, Nick, why? Like with breast
Mhm.
cancer, you're not worried about that. And I go, no, not really. But I go from the studies and I sent them the PubMed. I go, listen, this is much more than breast cancer. I go, we're talking prostate. We're
Mhm.
talking a lot of these things. Prostate is extremely estrogen driven. These studies are showing that very clearly, even though a lot of the medical field goes, hey, it's DHT. And I go, I've had many prostate people that have zero DHT in the body. And that's not the only picture, in my opinion. But the thing that's incredible about it, even for men, is how we talked about how these phytoestrogens naturally are only binding, for the most part, to estrogen receptor beta and not
Mm.
alpha, which is anti-proliferative and extremely disease and cancer reversing. And
Right.
so I go, this is to me, sure, are menopause and women the hot topic for sure, but not at the reluctance or neglect of the critical need in a man's life as well. For prostate is such a radically increasing mystery. I would even call it mystery because I don't find a ton of great success with a lot of people that I know that are going the medical route and they're not getting certain things they need and stuff. And so I go, this is a bigger picture, but it goes back to what you had said, fixing the basics, fixing our nutrition. And so, what do you say on, okay, we see in other countries for sure menopause being an issue to a certain degree. Even in the 1800s, you had talked about with Hippocrates and all of those things. Like, it's not like this is totally just the last 20 years only in the United States.
Oh yeah. Think of the word hysteria, right? Like hysterical hysterectomy. It was all because of women going through perimenopause and menopause.
Right. So, with the studies, though, that have come out and said, hey, listen, this is the radical decrease in other countries when it comes to certain menopausal symptoms, prostate issues, all of those things. And they're really discussing these more so around estrogen. What do you find from that general populative perspective is their benefit that they're doing in their lives, whether it's nutritionally or whatever, that maybe here we're not getting, which I'm sure it's more than nutrition. Like we said, it's their stress, it's
Yeah.
their
I
cortisol,
was
it's
gonna
all these things.
say, yeah, if you take like the Japanese culture in general, if you've ever been to Japan, that it's a lot more community based. Their nutrition is a lot more well rounded. They're very active, much more. Their cities are designed for a lot more activity, mobility, a lot of walking. Just things that we here in America aren't doing. It's not to say that they don't have, I'm not saying Japanese women don't get menopausal, perimenopausal symptoms,
Right.
but relative to packaged processed foods, toxicity, driving everywhere, we go from our bed to the couch or to our desk chair to the car to a desk chair, back
Right.
home to the kitchen table to the couch. There's very little movement for a lot of people. Maybe not to the people who are listening to your podcast, but if anyone's been to a big box store or to the airport or anywhere out in public and you looked around and thought, there's not a lot of mobility.
Yeah.
It's when I was in Europe a couple weeks ago, I was in London and there were when the you can tell like the health of where you are by the number of wheelchairs that are lined up for an airplane. And in America, we see a lot of wheelchairs lined up for people on an airplane. And in other places, I've been all over the world. I just don't see it as nearly as much. When there's 6, 8 wheelchairs lined up, maybe it's a lot of grandmas and grandpas. I don't know. But it's also really, I'm like, I'm not seeing this as much other places. I'm not seeing a lot of as much many walkers and canes and very immobile people who are really struggling. I'm not saying it doesn't exist, but you
Sure.
start to look around when you travel and go, wait a minute. Hold
Yeah.
on. Where are all the wheelchairs when I got off the plane in this European country or this Asian country? They just don't have it like we do. It's telling.
There was a picture that my dad's one of my mom's best girl my mom and dad's best girlfriend had posted on Facebook, and it was the beach. I don't know what beach, somewhere in the United States, I think in California, like the
I've
1970s.
seen that picture.
And on the caption it said, "Find one fat person."
Yeah,
And
I've
you
seen
couldn't
that.
find one. There was 1,000 people in that photo. There was no fat people. And it was like, oh my gosh. And then you look at the PE classes of what they were doing in the 30s, 40s, 50s, 60s, 70s, and they're doing pull-ups left and right. Like they're just doing it's
We
just
had to climb a rope.
yeah.
What? We had to
I
climb
mean
a rope to the ceiling of our gymnasium. We
that's
were on
that's
these jungle gyms outside that they would never allow now, would not be legal because it was pure cement at the bottom and screws sticking out everywhere. But we were all over climbing and jumping and as a kid, and now they have to fight for PE. Now there are some schools that it's 20 minutes, 30 minutes, or it's 2 days a week. They don't do it anymore. They don't even have recess in some places.
it's so I think that's like a big portion of it because I like you said, you just look around where you're at and it's not that those things don't exist anywhere else. It's that just in relationship to the greater population of it or in relation to us, it's
Did
much less.
Was it you I was discussing? No, I think it was somebody else. But have you heard the statistic? Like a huge percent of people over the age of 30 don't sprint and haven't jumped. And I
No,
heard this statistic. I heard the jumping statistic. Like this massive percent of people don't jump after the age of 30. And I'd heard it and I thought, geez, when was the last time I jumped? So I told my husband we walk our dog all the time. And we literally got on the street and jumped on the a curb. I was like, can I still jump? Do
yeah,
I? I don't
no,
think about jumping. So I'm sure I can jump. I'm sure I do jump over like rain puddles and uphill. Like I do. But to
yeah,
consciously think, when do you jump? So now I've incorporated jumping, whether it's jumping rope, I jumping box jumping. I have in our garage, we have a bench, like a workout bench. I jump on the bench, jump up my stairs. Like I need to make sure I can still jump. But I thought,
yeah.
yeah, this is huge. A lot of people, they're very forward, backward plane. They
So true.
run, they walk, they don't do anything lateral side to side or up and down. And
No,
it's
that is
important.
so true.
Flexibility and mobility is not all just about lifting weights. It's diverse.
So last year I had an apartment in Ikaria, Greece, which is one of the five blue zones.
Yeah.
And the blue zones are, even though all of my pillars and everything that I've found with autoimmunes and my success with that has actually been directly within codes that I've found in the Bible, the blue zones actually follow the same pillars that my
Hmm.
seven pillars are. And one of the guys in one of the five blue zones, Okinawa, Japan, he is 80 years old. He sits down and can pick himself up with his arms. And he said, it's not enough to move the body. He goes, what you have to do is be explosive. And so he
Yeah.
says, moving is one thing. He goes, karate chopping quick is another. And he goes, to me, this is one of the hidden secrets of Okinawa. He goes, we're very big on explosion. And so it's like you just said, jumping, sprinting. And then obviously we have too much science to even support that, like the benefits of what HIT and all those different types of concepts do for the body. So
Hmm.
I think that's critical too. One of the things that you had mentioned, just being in other countries and looking at wheelchairs, was a couple weeks ago. Every quarter, I just kind of learned this from my business coach, but every quarter I take 10 days off. And so about a month ago, I took 10 days off and I was like, I'm gonna go to Austin. I used to live in Austin about 8 years ago when I was competing for Mr. Texas and stuff back in the day. And I went there, I was staying downtown, and I totally forgot. It's probably been 7 years since I've been in Austin. And when I was in Austin downtown, everybody downtown was like a model. Every guy and
Mm.
girl, they're beautiful, they're running, they have good physiques, they're lean. Every place downtown, I ate out for every meal, and it was like I never went off my diet. Every restaurant had just really clean whole foods, not cooked in oils and it was just incredible. And I literally remember telling one of my good girlfriends that was down there, I said, this town, I forgot how health conscious it is. I
Yeah.
can walk, I live in a high rise in downtown Houston. I can walk outside of my high rise right now. And there's people literally on the street. Right now, I can tell you who they are, and they're in wheelchairs and
Yeah.
they're very overweight and they're this, that, and the other. And I'm just like, we have a different concept of normal. And I
Yeah.
always tell people normal does not mean optimal. It's
All the
normal
time.
it's normal to be diabetic. 50% of kids now are actually at least pre-diabetic. So it's normal, but it's not optimal. So when people
Yeah.
see somebody like a you or like a me who eats a certain way, we're called extreme. I go,
Hmm.
it's sad. That's that reality when I'm not extreme. I feel like this is just what should be considered normal.
Yeah, absolutely. What's the statistic? 93% of Americans are metabolically unhealthy. 93%.
Yeah.
93% of our entire country are metabolically unhealthy.
Yeah.
What? When
So
I read the statistics on fatty liver, so the National Institutes of Health says 20, but about a quarter, 24% of American adults have fatty liver. And I was like, and I would argue because the diagnosed fatty liver is a little tricky.
I thought
It
it was 46%. I actually thought it was way higher than that.
When you include all the levels of fatty liver, it is higher. But just like the
Okay,
most basic early form of
sure.
fatty liver, 24%. And at the time when I first read the statistic when it came out, I said before the bigger statistic came out, I was like, nope, it's way higher because we're not able, like nobody wants to do a liver biopsy and it costs a lot of money and you have to get a pre-auth to get a liver scan. So we're going off of labs for a lot of people and oh, you have
Sure.
fatty liver. And those who do get a scan or a biopsy adds more to the percentage. But I was like, nope, I bet you it's more than 24%. If we actually were scanning actually people, or I don't love biopsies, but if we biopsied all these people,
Right.
I bet we would see it way, way higher. And I think we would see it further progressed than regular old basic fatty liver. And sure enough, I was right. Sure enough, statistics have been changing since then to be like, ooh, we're actually moving towards like pretty significant liver disease. Like the percentage of people we thought was just regular old basic early stage fatty liver is getting worse. It's getting into fibrosis. I'm like, I know. You can see it on their external face and body. Like it's not hard. And it's now, but now it's considered completely common and normal. I'm like, oh, it's not normal.
When
No.
I was going to say, you can have like real Hashis type situations 8 to 10 years before your TPOAB
Yeah.
actually reveals itself. But same thing
Yes.
with fatty liver. You just look at all of these other things. I always tell people, listen, if you have the symptoms, if it looks like a dog, smells like a dog, and tastes like a dog, it's probably a dog. If you
Did
have,
you just say taste like a dog?
yeah, whatever. I don't eat dogs, but come on.
I
So
knew what you meant. That was awesome, though. Yes.
but it's the same concept. Like if you're having these different issues, not to mention, yeah, whenever I was studying, this was probably a year ago, and I had just seen a 46% statistic on certain things, but this is probably not the official diagnosis. It's more, like you said, the more broad
Yeah,
concept of it. This is a big reason why people are not losing weight. In fact, just a fun thing I went through, and then I have two last questions for the audience that I'd like you to get into
of course.
is in 20, when was this? This would have been 2020. And I used to actually, so I had a major food eating disorder back in the day. Every weekend, I used to eat myself sick. In 2020, I was leaning over a toilet, making myself throw up probably at least 2 weekends a month. I couldn't stop eating. I really had,
Mhm.
I would eat sweets and I would be stuffed and then I would just have to keep eating. I don't know. It was just a hard, I always had that. And bodybuilding really did that to me. I would hard diet and then on the weekends, that massive cheat meal that your coach might give you or whatever. And that just developed over years and years and years of time. And so in 2020, I had a dream and the Lord had really just convicted my heart on it that my liver was failing.
Mm.
So I went to the doctor, got my blood work done, and my liver enzymes were through the roof. And
Oof.
cold turkey, I decided, hey, you know what? I'm completely going to give up sweets. The only sugar I'm having is if it comes in whole fruits. And I did that in 3 weeks. I had lost on a body fat scan, I lost 7 pounds of pure body fat in 3 weeks. I'd gotten my liver retested and it completely regenerated itself. And I was like, it's amazing to me that this was all liver. Like my
Hmm.
fat loss and all of those things, it was completely liver based to show not only how destroyed it can get, but if you are willing to nurture it, how quickly it can recover itself. But
Yeah.
it's the liver that we don't really talk about, but the liver it's the workhorse of the body. So it's a critical concept. I
And
know.
it requires a lot of nutrients. You'll see on social media conventional practitioners who are like, don't do a liver cleanse. You don't need liver supplements. You don't need to do detox. Your liver was born perfect. It's what it does. And if you think of it like the air filter in a car, it's white, it's clean, it's perfect. You put your air filter in, and what happens after 5,000 miles? It's not white, clean, and perfect anymore. It's pretty dirty. It's done its job. And I say the liver is very similar because it requires so many nutrients to do its job. And it requires, not suggested, but requires. So if you're deficient in B12, B6, B2, vitamin C, etc., maybe you're not eating those foods, you're not absorbing those foods, you've low iron. Iron plays a huge role in detoxification. You're going to slow the liver down. And so I always, again, like gently push back and say, in theory, the liver should be great, but we pile in life and
Yeah.
lifestyle and habits and unfortunately the environment. And if you don't have a lot of these nutrients, like this is where we do need some liver support. We do need to address it from the inside out.
One of the things I actually learned from you on this that I didn't even piece together When it comes to the HSD enzyme being predominantly in adipose, liver, and brain, I've known all of that and how that can cause fatty liver. But what I didn't think about was like on a Dutch test, when metabolized cortisol is crazy high, and say the T3 is normal, the T3 is not in hyperthyroidism. You had mentioned how if they have a lot of adipose tissue carries obviously a lot of cortisol, fat carries a lot of cortisol, and that adipose tissue has direct access to the portal vein.
Yeah, the
So
liver.
bombard your liver. And I was like, oh my gosh, I didn't even think about that. There's so many ways that just being obese and stressed out is just ruining our liver.
What's interesting is back in the day, there was the HCG diet. And so all these people, did you know the HCG diet? Are you familiar?
No,
So
no.
HCG is the pregnancy hormone, but people would inject it and follow this very strict diet to lose weight. It was very rapid weight loss. This was 15 years ago, before GLP-1s even, they'd been around, but before they became more popular.
Yeah.
So anyone who would go on these whatever crash diet or very quick diet, they were losing large amounts of fat. And I would have all these women come in and go, I'm doing big weight loss things. I'm doing an HCG diet with someone. I want it, like, I feel crazy. Can you test my hormones? And I'm like, no, because as you're dropping big amounts of fat, as you're breaking apart these fat, a lot of the fat soluble chemicals, whether it's a
Yeah.
hormone, whether it's a paraben or a phthalate
Pesticide.
or a fragrance or whatever, where do you think
Yeah.
it stores? So if it can't get processed through your liver, it gets shoved in a fat cell. And I said, you're breaking that apart. So not only when you're doing all these weight loss, the fast weight loss, the rapid weight
Yeah.
loss, do we need to support your liver? And so I said, I'm not going to test your blood because it's going to be pure chaos right now. Let's wait till you get to the end. And so now watching all the GLP-1s, and I totally think there's definitely a time and a place for GLP-1, whether you
Sure.
microdose it or regular dose it.
Right.
But again, I'm seeing people and I'm like, oh, you're depending on your dose, you're getting all these rapid weight loss, and you probably have some serious crap trapped in your fat cells, and no one is paying attention to that. Not conventionally. In the functional integrative world, they are, but not conventionally. So you may need to do some liver support along with your fat cells, your fat loss.
That's incredible that you even say that. I've actually never, there's only one other professional that she's a doctor, and then myself. I've never heard anybody else talk about this except for you just now.
Oh
Where
yeah.
about a year ago, I was working with an individual. He'd never worked out. He was 290 pounds. In a year, we brought him down to 190 with abs looking. It was just he was the most one of the most dedicated individuals I've ever
Love
worked
it.
with in 13 years. It was unreal. But one of the things that I did with him from the get-go, just because of everything I've learned about mitochondria and fat tissue and how pesticides, herbicides, seed oils, they hide in your adipose tissue. So what I would do was for 4 to 6 weeks, diet him down normally. And then in my mind, I go, hey, I know that your mitochondria are getting devoured right now by all of these substances that your adipose tissue are releasing that now your mitochondria are having to devour. So every 6 weeks, I would flush him and then I would push autophagy for 4 weeks, whether it's through plant-based or whatever it is, to
Yeah.
clean out the liver, to clean out mitochondria. Then I'd go back into dieting. Six
Yeah.
weeks, and I would go through this cycle. I did that full cycle about 4 times and he never stopped losing weight perfectly and just kept moving and moving. He's actually the only person who's allowed me just for that long of a period just to go and just run this on him. And it
Yeah.
worked superb. And so
Yeah.
I used to teach my mentees about this where I'd be like, guys, you have to understand just like your nervous system, you don't want to always stay in parasympathetic. You want to have the ability to go into sympathetic. I
Right.
go, you want to have the flexibility. I go, same thing when it comes to losing fat. I go, losing fat is about damaging mitochondria, healing mitochondria, damage, heal, damage. I go, you have to. It's a part of life.
Yeah.
I go, just like when you work out, you have to tear with micro tears the muscle for it to grow back. I go, it's a part of life.
Yeah.
But nobody, I literally only this other doctor that I had learned from and myself have ever talked about that. And then just hearing you, I'm like,
I
Lord, they,
learned it again probably 15, 20 years ago watching HCG people, watching again because it was a popular thing, it was very rapid weight loss. And I was like, wait a minute, you are
yeah,
completely releasing all these fat soluble toxins and
yes,
hormones, good
true,
and bad things. And I was like,
sure.
we have to clean you and detox you at the same time.
No, that's so good. I love that. The last two things I'd like to, and we don't have to get too deep into this, but is regards to HRT for
Yeah.
women. I think that I actually just had a client the other day who their testosterone, they're going into menopause, but they're one of those cases where progesterone, estrogen fell quick. testosterone is still at a pretty
Oh,
really good level. And so
yeah.
they behave very PCOS-y, if you will. Um,
Yep.
and so I just mentioned, I said, hey, as we're going into this season, I go, I do think E2 would be a good thing for you.
Yep.
She was a past breast cancer case, as was her mom, and this, that, and the other. And so the clinics and her doctors said, hey, you're not an advocate for this and this, that, and the other. And I started explaining to her, I said, hey, listen, we have some pretty conclusive data that E2 does not cause this in any way, shape, or form. I go, this is an E1 issue. Not only that, this is a cortisol and stress issue. And not only that, it's not an estrogen issue so much, it's an estrogen receptor issue, which means that what I mean by that is a lot more than estrogen binds to those receptors.
Right.
Endocrine disrupting chemicals are your PCBs are binding to that all day and causing breast cancer, prostate,
Right.
whatever it is. And so, with that said, could you calm the nerves of a lot of women and different people to say, hey, listen, your estrogen is not the reason for all of your breast cancer, and
Single-handedly.
it is something that you can consider. And I think it is something with the right practitioner and coach, obviously not walking by yourself, it's something worth at least discussing on the table.
There's a great book, Estrogen Matters, by Doctors Carol Tavris and Dr. Blooming. And they were a great resource. So somebody's shown me a book. That's a great one. There is a breast cancer educator. She's a doctor, Dr. Corrine Men. She herself has had breast cancer. She teaches a lot about breast cancer and HRT. But I've long said single-handedly, estrogen on its estradiol on its own does not cause breast cancer. It doesn't cause any cancer because single-handedly on its own because we know cancer is wildly complicated, right? Like
Sure.
we know it is a soup of a million different things that can contribute to the creation of cancer. And to single-handedly blame it on estradiol
Yeah.
is really a disservice. And in that Women's Health Initiative study, when they were looking at, there were two arms to the study. One, women were taking what was essentially Prempro, Premarin and Provera. So they took a synthetic estrogen, ethinyl estradiol, and I'm sorry, conjugated equine estrogen, and they
Yeah.
took a
Like a
progestin,
progestin. Yeah.
yep, from Provera. And then the other arm was just the estrogen by itself. They did not take progestin. And the reason is they had a hysterectomy and didn't have a uterus.
A
So
bioidentical estrogen
no,
deal?
they took the CEE, the conjugated
See.
equine
Okay.
estrogen.
Okay. Okay.
When they came to the conclusion that hormones cause cancer, it was only in the combination. It was in the estrogen progestin combination. The women in the estrogen only, the conjugated equine estrogen only family, did not have an increase of breast cancer. They continued that part of the study quietly and continued, and at the in the follow-up checkups, the women continued not to have an increased risk of breast cancer. And that was with conjugated equine estrogen, which not bioidentical, synthetic, but they didn't have an increased risk of breast cancer. So there's a lot of misinformation around cancer in general, how people develop cancer, all cancers, everything from brain to prostate to pancreatic, right, to breast, everything. But single-handedly,
Right.
estradiol is not the big issue here. Now, I will say, in a uterine cancer situation, although I would argue environmental toxicants probably play a role also, in a uterine cancer, the increase of estrogen relative to progesterone, so like an estrogen dominant situation, that definitely is the big contributing factor for uterine cancer. It grows the layer up really thick, the cells get crazy, and they become cancerous. But in a breast cancer, we're looking at a very mixed soup of reasons for
Yeah.
cancer. And
Yeah.
because of the new research where we're looking at estrogen, like more people are starting to go, I don't think it's single-handedly estrogen that's the problem.
Yeah.
I think we need to look much bigger and broader than that. And so those are
Yeah.
two great resources. If you have had a history of breast cancer and you're thinking to yourself, I would really love to consider some sort of hormones. Where do I start? The book
Yeah.
Estrogen Matters and then the research and education by Dr. Corrine Men are great resources.
Yeah, my mom actually had breast cancer, and so this is breast cancer, and this is one of the big reasons why I'm very big into, as I've grown older, into menopause and to women's health and
Mhm.
breast cancer and all of those different types of concepts. And so, let me ask you this: with that, it was the CEE for the audience, conjugated equine estrogen. That's a synthetic estrogen. Progestin, that's a synthetic progesterone. Do you think that the fact that what if you got a bioidentical progesterone and a bioidentical E2, do you think that both of those would have had that same output as the CE and the progestin did?
It's looking no, but because they spent millions of dollars on the Women's Health Initiative, and so they haven't reproduced it using like that amount, that long, that big yet. They haven't done a study that looked at that directly. But it's looking like in the studies that we do have for the amount of time that it's looking no, doing estradiol in particular might even like decrease, of course, the risk of cancer.
And you had mentioned too that having that estrogen dominance can thicken your endometrial lining and cause a lot of
Yes.
problems and stuff. So not only having, because in the luteal phase when progesterone rises, it thickens the uterine lining so that if you were to get pregnant, you can carry on a baby. But having too much estrogen as well, either one
Yeah,
can end up
it's
causing into these issues.
unopposed. Yeah, unopposed estrogen is in the uterus is where we get into the issues down there. When we think of the uterus, it's like brick and mortar. So estrogen and progesterone are like brick and mortar. Estrogen are the bricks, progesterone's like the mortar. So it helps make it nice and easy and smooth and fluffy and adds throw pillows and the blanket. And it's like ready to go for implantation. And then if she's not pregnant, then think that's why with her period, when estrogen and progesterone are doing what they're supposed to do, usually women report, oh, I have really easy periods. I have really nice periods. I don't have super heavy clots. It's not really crampy. It's not heavy. Like then I know you're in a good flow. Once women start saying to me like, oh, my periods are so heavy. They're so thick. They're so clotty. They're so long. I'm like, okay, we have an issue somewhere between estrogen and progesterone.
Yeah, no, that's really good. And so with these women that, hey, they've had breast cancer, their doctors and other people are like, hey, absolutely not. Even though I think putting absolutely not a strong conclusion to come to without really going deeper. But let's just say for those people that are, their
Mhm.
doctors, they can't get on it regardless. What do you recommend on the surface for them? Obviously, this is
Yep.
a deep question that requires a coach,
Oh
practitioner, a
yeah.
lot of
Oh
nutrition
yeah.
stuff. But on the surface, at least if you were to be like, hey, let me point you here, let me point you there,
Yeah.
what do you think is a good route for them?
So definitely one of the things that they can still consider the low dose vaginal estradiol or the 6.5 milligram DHEA. So at least we can help support their genitourinary syndrome of menopause symptoms. So if they're having dryness, pain, urinary tract infections, itchiness, atrophy, shrinkage, anything going on in the vaginal, bladder, urethral area, like we can still support that. And both the Menopause Society, the American Urological Association agree that it doesn't increase the risk of recurrence of breast cancer. So we do have options there. We have a number of medications. I just want to put all the options out there. We have a number of medications that they can still use and try for things like sleep, for things like hot flashes. Like we have other non-hormonal options. Now, having said that, you're listening to Nick's podcast. All of the pillars that he talks about are like absolutely critical. Even if you could go on hormone therapy, even if you find a doctor who's, oh, yeah, your breast cancer was 15 years ago. I think you can totally do hormones right now. You still have to do the pillars because you still have to make your mitochondria, you still have your receptors, like your liver, like we still have to dial those in because the hormone, it's a seesaw situation. If you're really inflamed, really metabolically not well, really your mitochondria aren't, you feel like crap. The hormones alone by themselves aren't going to take the trash out. Just
Yeah,
like you may find like dialing nutrition, supplements, liver community super helpful, but not going
right.
to necessarily replace the hormones. So it is this seesaw benefit we have to do. And I was talking to a good friend of mine, Dr. Tina Moore, the other day, and we were both talking about how so many women will go on hormone therapy, estrogen, progesterone, and they will love it at first. And then they're like, oh my God, I'm having all these side effects. I hate it. I have to adjust it all the time. And I'm like, I don't know if it's the hormone or the person receiving it because you were so inflamed to begin with. You were one of the 93% metabolically unhealthy. You're still just doing 2 glasses of wine every night.
Yeah.
A lot of ultra processed food, a lot of plastic, a lot of fragrance. Like, I think we
Your
really need to
hormone
step
receptors
back.
probably aren't even receiving that hormone
And
signal
they're
well.
probably mad.
Yeah. Right.
Everything in
Well,
the body is mad. And so while I am a fan of hormones, I am also at my heart an integrative holistic doctor. And I'm like, we've got to do it both. We have to do it all. We need more education on the and everything.
it's like giving somebody T3 with cell danger response.
Oh, yeah.
Their T3 stay. In fact, I experienced it myself where I actually, when I used to run thyroid medication when I was dealing with my autoimmunes and all of that, we increased my NP thyroid, which has T3 in it,
Yeah.
and my T3 on blood work went from a 2.9 down to a 2.5. My body was like, "Screw you, stop."
Yeah, your cells
T3.
were like,
Yeah.
no, you don't
So
get
same.
this.
So it's probably. Would you agree that it's probably similar in regards to hormones? It's still receptors with hormones. Like T3 is a form of a hormone. So would it could it be that same thing? Hey, you're already in bad cell danger response. You're not receiving any of the hormones efficiently that you're putting into your body. Could that be the case?
There's a really good chance, yes. Because again, some women go on hormones and it like rocks their world. They feel amazing. They don't have
Yeah.
to adjust it all the time. And I'm like, fantastic. But I get so many comments from women, so many comments from women that are like, I went on hormones. I thought it was going to be a miracle changer, and it wasn't. I hate it. I have all these side effects. I don't know what to do. We're
Yeah.
constantly switching. I think I'm allergic to progesterone. I think I'm allergic to estrogen. It made me feel worse. I gained weight. I'm like, oh, okay. Yes, this is your body was not ready to receive. Like there's a lot more seesaw work here. We had to work the other half of the seesaw at the same time.
Yeah. And then my last thing to give the audience like practical steps. One of the things that I tell a lot of my women that are in this 39 to 54 age range and stuff, and I see very clearly that they are either in perimenopause or they're going right into all those things. I tell them, I go, hey, listen, and they've come to this agreement that they go, hey, Nick, I want to keep you as my coach for about 2 years, 2.5 years. Please get me through this phase of life
Yeah,
that's killing me mentally so that I can live the rest of my life a champion, essentially. And I'm like, no,
totally.
I think that's a smart move. I go, let me walk you through this for the next 12, 18, 24, 28 months. And then after that, boom, you're going to be good to go because you're going to live the rest of the next half of your life in menopause. So let's
Yeah,
at least dedicate ourselves here. So that's always been my thing is, hey, don't walk through this alone. Find a practitioner that is
yeah,
passionate about this menopausal concept that is not going to like one of my women just the other day, she sent me this long message and she said, Nick, I feel like you really just understood me and you
hmm
validated a lot of my feelings and my symptoms that nobody else is. And I go, listen, this is much bigger than your night flashes or your hot flashes and night
yeah,
sweats. I go, this is your immune system. This is
mhm,
choline now missing from every cell of your body. I go, this is way bigger than what we say it is. And so
yeah,
I get that. I'm not a woman, but like I've studied it enough. I've
yeah,
learned about these things and I've seen it enough. And so with that said, that's my advice to people when they're going through this. Hey, find somebody that you can cling to and really walk through this.
yeah.
What would you say your practical steps are for these women that are getting close to that or are going through that? What should they really start stepping into to get through this window of such a tough
Yeah.
season of life that is also, might I add, wreaking havoc on their marriage because they're so moody. It's destroying a lot of their life in a lot
Yeah.
of ways. And so I
Oh,
think
yeah.
hearing from somebody like you who not only is an expert in the field, but you practically are going through perimenopause and
Yeah.
stuff like that.
Not
So
practically. I am.
what would you say for them?
My favorite quote is by Glinda the Good Witch from Wizard of Oz. And I tell women, you have always had the power all along, my dear. I don't
Wow.
want women to give away their power in this phase. I know it can suck, and I know that they're not feeling well, but at the same time, there's now so much great education out there. There are wonderful experts. Even if the person you cling to is on social media and you're reading what they have to say, you're reading their book, you're following their suggestions and guidelines or advice, or you're going to your practitioner or coach about it, like you take the power back. I know initially you don't know what's happening to you. I know initially it's scary, overwhelming, and you feel like your body's betraying you. But now is our time to shine. Like now we are Gen X, we are late millennial. We are going to take this power back. We're going to get educated and go. If your practitioner gaslights you, doesn't agree with you, doesn't know what they're talking about, you just find a new practitioner. And if you like your practitioner for primary care, colds and flus, your PAP, fantastic. You could just add to your medical team. If you took your dog to the vet and the vet was mean to your dog, I guarantee you'd find a new vet. Same for your child. If your pediatrician said something you did not agree with, you'd probably fight back or get a new pediatrician. It's the same for you. You have a 6 to 10 year transition that you need to find somebody who is going to support you and get you through this while you educate and empower yourself.
No, that's really good. Man, that's so good, Dr. Carey. Thank you so much. And can you share with the audience too? I know that you have a fantastic podcast out right now called Hello Hormones. Or not,
I do. Hello, hormones.
yeah.
Yes.
So can you share with the which all of Dr. Carey's Instagram and stuff like that's going to be in the bio for this podcast. So please go follow her. She has tons of good content. But can you, whether it's your podcast, other informative concepts that you're giving out, can you share with the audience where they can find those and how to
Yeah.
stay in touch?
Everything is on my website, drcarriejones.com. I have a ton of free ebooks and education. And yes, I am on Instagram, all free education. It's all hormones. I am on YouTube, all hormone education, if you want to see my face. And if you don't want to see my face, you'd rather listen, then there's the podcast, Hello Hormones, where I have a lot of individual just education, what's going on with me, what I'm seeing in the research, and then now interviewing amazing guests because I'm in the thick of it too, and I want practical, tactical information out there for all of us.
Yeah, no, that is awesome. I can't recommend to the audience enough. Study Dr. Carey's work, study her literature, study her podcasts, all of those different types of things. Me as a practitioner, I can honestly say I've just over the course of the half of this year so far, I've just learned tremendous amounts from Dr. Carey and consider her such a strong mentor of mine. Thank you, Dr. Carey, for joining this podcast. I know the audience is loving it. I've loved it, and I can't wait to end up having you back eventually.
Absolutely. Thanks, Nick. I appreciate it.
Absolutely. Once again, everybody, stay tuned for the next episode of Lifestyle of Eden podcast.